This is Smiles TV. Welcome to Smiles Television Talk Show. I'm your host, Stephanie Anthony Miles, and thank you for tuning in. We are doing a 3-part series on mental health matters. We're going to take you from the home to the schools to the streets and to the prison systems during this 3-part series. Today, I'll be talking with a clinical professional counselor who deals with mental health issues in a variety of aspects. Her name is Sandra Ray Hyatt. And in the second half of the broadcast, I'll be talking with a Miss Tanji Stringfellow, who's an educator from the Missouri side of the river. Don't go away. You don't want to miss this broadcast. Stay tuned for more Smiles.
Hi, I'm Edie B for Smiles TV. During this first segment of the broadcast, host Stephanie Anthony Miles chats with clinical professional counselor Sandra Ray Hyatt about unresolved childhood trauma. Sandra Ray Hyatt is a licensed clinical professional counselor in the state of Illinois. She has worked as both a therapist and psychotherapist with various populations addressing issues such as anxiety, depression, trauma, and other mental health disorders. Stay tuned and learn how unresolved childhood trauma shows up in everyday life.
Welcome back to Smiles Television Talk Show, and I'm sitting here with Miss Sandra Ray Hyatt. She's a licensed clinical counselor, and she's going to help us understand quite a bit about various mental health myths and even dealing with unresolved childhood trauma. Thank you for coming to Smiles Television Talk Show. It's a pleasure to meet you.
And thank you for having me here. It's a pleasure to meet you as well.
You know what? I have to tell everybody, I've been on the phone with this woman since, I believe, 2020. And we have just now got an opportunity to meet in person. And I thank God for your being willing to do the broadcast with us.
Absolutely.
Do this for me, if you will. Tell our audience a little bit about your background.
Well, I am a licensed clinical professional counselor in the state of Illinois. I've been doing counseling for about, since 2017. I have worked with children as young as 3 and adults all the way up to the age of, about 85. And providing counseling with areas of anxiety, depression, post-traumatic stress disorder, and just another different amounts of populations. So I just have a whole lot of experience with different people.
Well, you know what? We've talked, like I said, over the years, so you know a little bit about my background and history, and I'll share a little bit with the audience. During a period of time, I dealt with some pretty serious mental health issues, and so as a result of that, I feel a need to share with our audience and with others how you can still manage and be professional and succeed even with what we call mental health issues.
Absolutely.
But one thing today that I really want to go over is unresolved childhood trauma. First of all, give us a little definition of what we're talking about.
So unresolved childhood trauma are traumas that occurred in childhood that were never addressed. And children carry those feelings, all of the hurt, the pain, emotional hurt from usually parents, people in their home of origin, and they take that with them into adulthood, never learning how to cope in a healthy manner. And so it shows up in different ways as adults.
So as adults then, so how does it show up?
It can show up in mental health challenges, like children that's been exposed to domestic violence or children that has been exposed to abuse. As adults, it show up as anger, that's masked in fear. It shows up in their interpersonal relationships, They're not able to maintain healthy relationships because they have trust issues. They don't know what healthy relationships look like because it was not modeled for them. It shows up in their physical health. Sometimes they end up with hypertension, fibromyalgia, just to name a couple of health conditions.
One thing that we talked about on the phone was anxiety disorder. And that's one of the ways that it seems to show up as well. What is anxiety disorder?
Anxiety disorder is an emotion that's characterized by intense, excessive, persistent thoughts of impending danger, calamity, or some misfortune that's going to happen, and it's just overwhelming for the person.
You know, and using some personal experiences, when I had been married for 20 years, and in the early part of the marriage, it was a lot of yelling in the household, and I call it a lot of verbal abuse at the time. And I will say this today, my ex-husband does profess to be a Christian, so he's been changed. However, during that time, I was fussing back at him and he was fussing, so I can't just say he was the only one. But there was a lot of loud talk in the house, and I could actually see how that played out with my children. For example, my son, for example, was very quiet. And seemed to be withdrawn. And I always attributed that to maybe it was just too much tension in the house and he was afraid. Can something like that cause such problems?
Oh, absolutely, because when there's a lot of yelling going on in the house, the children feel like they're not being heard. And it makes the atmosphere of the environment feel unsafe. So they don't feel like they have a voice. And they walk on eggshells because they don't want to disrupt any harmony in the home.
I do remember one time, and I'm guessing the age, probably 7 or 8 years old, he said he had problems going into the store and just talking to people. He said, well, Mama, I want that to change. And he said, I'm going to start going in the store on my own. He said, I don't want you to go with me. So he started practicing himself going in. So now, people think he's outgoing, but he forced himself in those kinds of situations. He did say that there are some times when things come up, he can find himself kind of humbling down and not willing to share. And that possibly can be as a result of some things.
Absolutely. And that was good that he was able to find a healthy technique intervention, and that was by him exposing himself to what he was afraid of, bit by bit, and he overcame it. So that's great.
Okay, so let's continue. Unresolved childhood trauma, and it presents itself in different ways as adults. Go ahead, and I cut you off in some of your.
Oh, that's okay. It also affects self-esteem. It interferes. Sometimes they end up using substances to mask the emotional pain that they feel, so they get into substance use. It just affects the whole person. Their mental well-being, their physical well-being, relationships, and even their quality of life.
Another question I have, you hear the term hurt people hurt people. So do you find that in individuals who've grown up and have unresolved childhood trauma, that they tend to pass that on in their families as well?
Oh, absolutely, because what they're modeling is something that was dysfunctional, but it was normal to them. So yelling to resolve issues was normal in your household. And so children can pick that up, and because this was modeled when they grow up and have children, well, that's how they resolve issues, is by yelling, and then later on, everybody's sitting at the table as if nothing happened.
So individuals can have low self-esteem as a result of what's going on in the household, and so they carry that throughout life, and it shows itself in various ways. We were talking about negative core beliefs. Break that down and tell us about that impact.
Okay, so if a child is in home where there's domestic violence, a lot of verbal abuse, physical abuse, and the child hears, you're nothing, you'll never be anything, you're just like your daddy, you're no good, and that's repeated to that child, remember that they're in their developing years, that stays with that child, and they develop a negative core belief about themselves that they are no good. They live up to the things that the parents tell them. You're no good. You'll never be anything. You won't amount to anything. Nobody cares about you. And so that's a narrative that stays in that child's mind, that's played over and over and over again like a broken record. So every time they don't achieve, every time they fail, that's what they hear.
You know, that is amazing. My mother was a school teacher. She taught for, I guess, 39 years, whatever the limit is that they teach, up to almost 40. And she used to always tell us, don't tell a child that they're bad. Don't tell a child all these negative things, because they will try to prove you right. They're going to do what you tell them they are. They're going to become, and so the opposite must apply. So we don't want to lie to kids about things, but we want to encourage them, I guess, in a very positive way.
Absolutely. It makes all the difference in the world. If you think about it, it shows up in our school system. So you have children who come to school, they're angry, they're afraid, they have low self-esteem. Whatever it is that they didn't get from home, they're looking for it in the school setting. And they're looking to be able to control their environment because they feel that they have no control at home. They become bullies sometimes, or they become bullied.
And that, I'm glad you mentioned that, because we're going to bring on Tanji Stringfellow in the next segment. And she's an educator on the Missouri side, and she's going to talk to us about the impact that various mental health issues have within the school system. So that I'm just so grateful for you. Is there anything that we did not discuss in this segment that you think is important? For example, I know we need to give the information about how people can make contact with agencies. You can give that, but is there anything else that you want to make sure you share?
I'd just like to say that if you are experiencing any mental health issues, or if you're having any suicidal ideations, please call 988-SUICIDE. Get in contact with a professional counselor who can help you navigate these issues.
Thank you, Ms. Sandra Ray, and I thank God for you. And stick around, because you're going to join us with Tanji Stringfellow. And you stick around too. We'll be right back with more Smiles.
The Smiles Television Talk Show wants to showcase your business, organization, church, and activities. If you have an interest in being a guest on Smiles Television Talk Show, or if you have any show ideas, contact Stephanie Anthony Miles at smilestv777@gmail.com. You may also call 618-741-3770. Tell your friends to subscribe to the Smiles YouTube channel. Let Smiles TV increase your reach. Remember, you look better with Smiles.
Unresolved childhood trauma also shows up in our schools. During this second half, meet Tanji Stringfellow, a dedicated educator with more than 20 years of experience. She's an award-winning teacher, teacher trainer, professional development specialist, content developer, and curriculum specialist. Ms. Stringfellow has been nominated for the Presidential Award for Excellence in Mathematics and Science Teachers, the Robin Kyle Science Trailblazer Award, the Initiative Teacher of the Year Award, and she is also recognized for her work in science, technology, engineering, and mathematics.
Welcome back to Smiles TV. I am now sitting here with an educator, Tanji Stringfellow, along with Miss Sandra Hyatt, who's a clinical professional counselor. And Tanji Stringfellow, thank you for coming to Smiles Television Talk Show. You know, I have to just touch you, shake your hand, and say thank you, thank you, thank you. Tanji and I go way back. I used to be a public relations director for a local college, and she was my student worker. And she's all grown up now, and she's an educator herself. How are you, Tanji?
I am wonderful. Thanks for having me, and I'm excited to be here.
Yes, ma'am. Please tell our audience about your wonderful background. You can't give them everything because there's a lot to you, but I want to talk about the STEM program and how you're involved in it, and go from there.
Well, since graduated from Harris Stowe. I've been an educator for quite a long time. My area of focus is STEM, science, technology, engineering, mathematics. And I am one of our state finalists in Missouri for the Presidential
Oh,
Award.
congratulations.
Oh,
you can talk a little louder so
Thank
I
you.
can really hear you.
I've received the Robin Kyles Trailblazer Award in Science, an Innovative Teacher Award, among a few. And I am passionate and I love my job.
Awesome.
I love working with our children.
Good for you. Good for you. And prior to your coming to this portion of the broadcast, Miss Sandra and I were talking about unresolved childhood trauma. And one of the statements she made, maybe not verbatim, but she led to the implication that how it definitely impacts the kids in the schools. So from your perspective, what have you seen?
Oh, wow. That is a very good topic. I think everyone needs to be aware of childhood trauma and the way it affects our kids. Our students come to school limited with a lot of emotions that they don't really understand what to do with it. And they're fights, they're hungry, they're bullying.
Yeah.
And they don't understand what's going on with them.
Well, let me ask you this. So let's say what grades do you deal with primarily?
Primarily elementary, kindergartners through 5th grade.
Okay, so you get a chance to see them early in life.
Yes.
Okay, so Miss Andre, at that age, kindergarten, have you dealt with children in that age range as well?
Oh, yeah, absolutely. And whatever is going on, whatever's lacking in the home of origin shows up in the school system, because if they're hungry at home, they're going to be hungry at school. If they're mistreated at home and bullied at home, they're going to bring that behavior to the school. Either they're going to bully or be bullied. And it's going to affect them, even their learning skills, because they're distracted by the things that's going on at home. They're walking on eggshells, so to speak.
Wow. So have you seen that?
I see that a lot.
Okay.
Sometimes children will come to school. I've even had a kid say to me, I have anger issues. Because he knows that he's had anger issues. But going unchecked in a school, it looks like a lot of fighting, low academic achievement. Students are refusing to even try because it seems like their self value is really, really low. They're very needy a lot of times, but really don't know how to articulate it. So as their teacher, I make it my business to accommodate the students, having snack time, extra opportunities to show that they're successful, to try to deal with that and really set an environment that's safe for them, very nurturing and safe, that trying to make sure that trauma isn't dealt with, or that they're not afraid in those classrooms, to make them more successful.
What about the parents? You've identified a student in the schools, definitely has some behavioral issues. How do you deal with the parents? And sometimes parents don't even understand what's going on themselves.
True story. 4th grader, I've taught 4th grade, had a baby, came to school, had been living in a vacant house. Mom was young when she had him. Grandmother died shortly after. So this baby has literally been sleeping in cars, sleeping in vacant houses, and helping mom raise the other kids. Mom's only 15 years older than her oldest child. He didn't know. Mom didn't know. Baby had lots of issues. What's bothersome is that no one knows how to deal with it, because it comes across as bad when I call them brilliant and something has happened. So dealing with what happened with the child was able to turn him around and get him academically involved. But we had to create a safe space for him, because that's all he knows. And when you have a kid that's about 10 years old, and he asks the administrators or the adults in the school, have you ever lived in a vacant house? As if it's a norm for them.
Mm-hmm.
So there's a lot of that, and many of our kids come to school.
So
with that, and the parents don't know.
Mm-hmm.
They don't realize
Mm-hmm.
that they're traumatized. So it's just coming down generation behind generation. So they need help as well.
I understand. So, Ms. Andre, a scenario like that, and as a professional clinical counselor, how would you deal with that situation?
With a child that age, I would try to get him into counseling so that he can have a safe place outside the school system where he can learn how to cope with what's going on, and I would get the mother involved. Because like Tanya said, a lot of times the parents are unaware. Look at it like this. She's 15 years old. Something had to happen with her mother. There's got to be a history, a pattern somewhere. And now this child is being made responsible to help take care of his siblings. So he's being adultified at this age, taking on responsibilities that he shouldn't have to take on. He has a lot of issues going on. So if you can get the whole family into counseling, then it could help them cope with life, give them things that they need. If they're living in vacant houses, they need community help, community resources, get them the counseling that they need for their mental health well-being, whatever they need. If there was a holistic system in place at schools, because that's where it shows up at, then I think it would turn around a whole generation, because you have a lot of families who don't know what normal is.
Right.
And like I said, like domestic violence is not normal. But because they've been in it since they were babies, that's what's normal to them.
Right. And Tanji, have you seen kids come in and you can tell they've been battered and bruised and things of that nature as well?
Yes, it's difficult. The parents are clueless. The students don't know, and the educators are stumped. What do you do with kids that are clowning in the classroom? You don't know what's wrong with them. The counselors can be overwhelmed sometimes. Social workers are inundated. And the educators just don't know what to do. So it's like a system that needs to be addressed inside of our schools. And I agree to focus our schools a little bit more in dealing with the trauma, because now we have massive rates, I'll say, of children that are coming in traumatized, and no one knows what to do. We think this is a solution, but there's a lot of academic failure where kids can't concentrate when they're hungry. They can't focus when they're angry and not understanding why. And the kids will tell you, I'm just mad. Why, baby?
Yeah,
I don't
they
know.
don't know.
You know, that reminds me. So I substitute teach periodically in the St. Clair County area. And one student, I believe I was like in the fourth grade, I can't remember what grade it was, the third or fourth. And this little baby came in just mad, right? So I called him to my desk. I said, well, baby, what's going on? He said, well, they keep messing with me. I said, no, you came in here angry. And he said, well, they just keep messing with me. They call me P-boy. And I said, why do they call you that? And he just said, because my clothes are not clean. So we talked a little bit, and I'm a substitute teacher, so I'm trying to encourage him as best I can, right? But anyway, long story short, he goes to his seat. And then eventually he comes back, he said, I don't feel good. I need to go home. I said, well, why do you need to go home? He said, well, I'm sick. I said, are you really sick? And he told me, he said, no, ma'am, I just want to take my clothes so they can wash them in the laundry room. So in the school systems, there's something set up where the kids can do laundry in some of the schools if they need to. And he had been picked on a lot because his parents at home were not taking care of his needs, and so he had to come to school smelling like urine, and it caused him to act out. And so once he told me that, and he left out, and like the department did whatever they needed to do, and he came back, he was a slightly different child. You know, and I told him, I said, you know, even if your parents aren't taking care of you, you take your own clothes, go in the bathroom. I showed him how to wash by hand. And I said, you can start doing some things for yourself and even help your mom and teach her that some things need to be done. And I'm a sub, right? So, I mean, so you guys deal with this every day.
Yeah. And even the lack of education coming from the homes. Some students have parents that are non-readers or limited in their reading. And so sometimes that fourth grade or that third grade is the only person in the house that can read and comprehend. And so there's another burden on the child, because now I need you to go home and read this story to your parent. Read this story to your grandparent, because there's a generation that quit school, 8th grade. Then there's another 8th grade, they stopped school. And now it's happening again. In 8th grade, they're quitting school. So what do we do about those students that go home and have homework and no one's there to help them with that? That's traumatizing.
Yes.
Within itself, kids having limited access to food. And so coming to school with all of those issues, and it's like, okay, you have to teach academically. Well, I'm able to do it because I understand that there's a need that has to be met. So making sure that I'm getting with the nurse and making sure that I have food in their classroom that kids can eat. Cereal. No one knows what a Dixie cup of cereal will do for a kid at 10 o'clock in the morning because they've had no food. And if you're having a breakfast program and they're healthy, and the kids don't like it, so the kid didn't eat last night, they're not going to eat breakfast. Okay, there's no snack. Now there's lunch. They don't like the lunch. So the only thing that they can eat are the big bag of chips that the school says they're not healthy. You can't have them. So this kid is all day long
hungry,
with no food.
So, you paint a very dim picture, and it's sad to see, but this is the reality. So, Ms. Sandra, as kids are experiencing this at such a young age, and homelessness even, and we're going to do a segment in some future broadcasts on homelessness and mental health issues. How would you suggest, from your background, if you could pull in, what's the solution here?
It is a huge problem because there's so many problems, like just contingent upon the other. So if a child is in the home and there's yelling and screaming, they can't focus on getting homework done. If you have a father that's throwing the mother up into the wall, they're trying to survive. The only way, I shouldn't say the only way, but one way I think, as I said before, that can help is if teachers are trained, administrators are trained from the top to the bottom. If they are trained to identify what trauma is in children and how they respond to trauma. So a child that's been abused, he may respond to trauma by yelling and screaming. That's a normal response to trauma because he doesn't know what to do with those big feelings. So I'm thinking that if we could get some type of training in place so that people can identify what it is and stop labeling children with ADHD when actually what it is, they're nervous and hungry and afraid. I think that it would have a huge impact on the population.
That's excellent. Yeah, I would agree with that. And Chandra, we're going to have to wrap up soon, and I'm going to have to bring you back on because you got a lot of wealthy history that we really want to share with our audience. But if you will, as an educator, kind of wrap up for us what you see and how you believe things can be solved.
I think that as educators that we can create an environment that's safe for our children, that's nurturing for our children. And I think teachers should be given those opportunities. I think schools are doing a good job in addressing trauma, but again, it's so massive that no one, I don't think, really knows exactly how. So in my mind, I think about being a student at Harris-Stowe, and I'm thinking I would have loved to have a course in undergraduate, how to deal with that. Going into the profession or even intervening as professional development, helping me understand what's really going on with the kid.
Well, I want to thank both of you for sharing your time with Smiles Television Talk Show. And there's not enough time in the day to get out the information we need to. I want to thank you for tuning in. And we're going to be doing a series on mental health matters. Today we were dealing with unresolved childhood trauma and unresolved trauma in the schools. We're going to take you on a journey to homelessness and how mental health impacts those who are homeless, and into the prison systems, individuals who are trying to re-enter society but still dealing with some issues. Thank you both. for joining us on Smiles Television Talk Show. And I really, really appreciate it. It's a pleasure meeting you for the first time, and good seeing you again.
Thank you.
Keep up with Smiles Television Talk Show. We're growing. Go to my website, www.smilestv.show. My YouTube channel, check us out. And remember, only what you do for Christ will last. And Jesus is the Lord. The Lord be magnified. Do you have a Christian ministry, an inspiring story, an innovative idea, or an upcoming event? Are you an artist, an educator, healthcare provider, author, or musician? Since 2013, Smiles TV has shined a spotlight on the good happening around the world. Contact Stephanie Anthony Miles at 618-741-3770 or send an email to smilestv777@gmail.com. Let Smiles TV tell your story. You look better with smiles.
IDEX Media does a lot. From IDEX Photography to IDEX Films. We help create forever memories and forever impressions. Imagination, image a world. IDEX Media.
Awesome sauce. Yeah, baby.